Right. If we could welcome Mr. Mark Jassen to the stage. He is a nuclear medicine radiographer, qualified 2009, and has been working at Red Cross Children's War Memorial since 2010. During that time, Mark has been a radiographer, but he's also played quite a big role in the IT department. Red Cross's radiographers have to multitask quite extensively. Also, in 2021, Mark was appointed Secretary of the South African Society of Nuclear Medicine and has, in that capacity, also fulfilled quite an IT position. So, Mark, thank you for that and welcome.
Thank you, Dr. Kotze, and thank you, Prof. Mukwala, for the invite and allowing me to speak. So one thing that all of you will notice is that the talk that I have on, I'm sorry, I see it there, apologies. The talk that I have on my end and what you have on your program, it's two different topics, but it's not an error. I did that on purpose because for me to address the pediatric imaging and patient positioning, we have to get your child basically in your department and on the bed. No patient, no scan, no images. So as part of the talk, what I would like you guys to take home and what I am going to give you is basically enhanced communication. And here what I mean with that is drop down to patient level, explain everything to your child. You do not want to leave anything out. You don't want them to feel neglected or that they do not know what's going on. I'd also like to just address a few key points to help you deal with a pediatric patient. At the end of the day, what you would like to do is to gain the cooperation of the child and to ease patient-parent stress or worries, because there will be a lot, especially from yourself, perhaps as well. You would like to create a calm environment. Whatever stress you have will be projected onto your patient, will be projected onto the parents that might come with, if it's an outpatient. So if you are calm, your child will be calm. You can explain everything fully to them, and you will notice that as we go on through this talk, the word explain will come up a lot. Make your department pediatric friendly, please, people. Kids get distracted with a lot of things and you want them to look at images, toys. We were a little bit limited with what we could put on the walls of our department at first. So I just want to show you what we had in our previous department and then what we've got now in the not so new old department. So you will see there is a little bit on your screen, you will see just some stuff that we've put on the walls for the kids to just read a little bit, have books and stuff that you can go through with them, and some toys. For infection, soft toys like these, you don't technically want them. So get something a little bit more robust that you can wipe off and clean, because the soft toys like these, it carries germs with it. Okay, there's a few things in my talk, seeing that it's a talk that I gave in 2018, that I'm going to brush over, and a few things that I might not get to. So what I want to, I'll stay on the slide where I think it is, where it is important. And then for the other things, I will just quickly brush over. There might be things that I'm not going to get to. So this section is for the radiographer. When I started at Red Cross, our old professor, Professor Mike Mann, asked me, or basically us, What's the most important thing in a nuclear medicine department? And one would think it's the gamma camera, it's the radioactivity that you're using. But it's not, it is actually you, the radiographer. So please remember that. Start your day, please, with a cup of coffee. For me, by this time when the child gets there, that's my second cup of coffee. And do that while the QC is running. You need that caffeine to get your day started. It will make things a little bit just easier. So the next two things, it's things that you can do a day before the time, well in advance, just so that you know that you are prepared for what you have to do. You don't want to get the child in the bed and then you have the incorrect request form or you are doing the incorrect procedure. No one likes repeats, not the child. Again, you can just plan this beforehand. So once you've now done everything there, you're going to now locate your patient. Outpatient, call them, hear them, what time they'll get there. If it's an inpatient, ask the ward to drip the child, get IV access. That will make things easier for you. Then your child can come down. Okay, so when you now have located your patient or the patient has arrived, the fun starts. The following items that I've got here is a patient perspective, is from a patient or parent perspective, sorry, not patient. As a parent myself, once you go into once you go to a clinic or to whatever doctor's appointment with your kid, all of your medical knowledge goes out. My child is sick, I don't know what to do. The following that you've got there, these are just some questions that we have been asked over the years, and you will have to address all of them. What I can suggest you do is explain everything beforehand, include all of these things. For those who would want my talk, I will make it available to you because there's a few things that like I said, I won't get to. But just explain each and every step of the procedure. It will just make things a little bit easier. So when your patient gets there, you will have a little entourage. And the little entourage is the whole family. That is your patient. That little one. But questions will come from each and every one of them. Everyone, brother, sister, mom, dad, and granny, from all of them. Explain, explain, explain. Okay, now we're getting to another fun part, the approach to the child. Children are fun to be around if the correct imaging technique is used. Never rush your child. Explain and allow them to touch things, allow them to touch your machine. Leave your white coat in the lab. It freaks everyone out. You can use that while you are drawing up your dose, but once you're done, leave it there, get back, and start your scan. Again, explain, explain, and explain everything thoroughly. You will get all of those questions more than once, even if you've explained it again. Just prepare yourself that you're going to have to explain everything. Give your child enough time to familiarize themselves with their surroundings. Let them touch the machine. Let them get on the bed. Please, if you're going to get your child onto the bed as your first thing, they might just get off and run back. Whenever they see that, explain to it. Let them touch it. Let them get on the bed. Just allow them to take their time to familiarize themselves with everything that they have in front of them. Okay, just a little photo of our old machine. So you can even put stickers on your detector so that they can just have something to look at while you're busy scanning. And then this is just a mural that was created for us. You do not want to be labeled as a liar. Never lie to your child or to your patient specifically. Once you start lying and once they find out, you have lost all trust. One of my very, very favorite ones, and never underestimate a child's capabilities. They are strong, they are fast. Yes, that small little baby can move out of your field of view if you do not watch them or if you do not hold them. You might even find while you're dripping them that, oh, I'm going to break this child's hand or arm. It will take a lot, but don't go too far. So never underestimate them, please, people. In some cases, if the child starts acting out, it's best to send the parents out. So toys, movies, and even just talking to the child, that can be a very good distraction. So have some books in your department, you can read it to them, have a movie played, let them choose the movie themselves. And then constant supervision is essential. We had an incident, I don't want to call it an incident, we had a patient on the bed the other day, and while busy with the milk scan, I just saw our ComServe running in, and the patient basically moved out of the field of view as we were scanning them. So it's always just keep an eye on them, because whatever you're using might not be enough to keep them on the bed. And this is just to show you the addition to our department, which is the TV. Sorry, there's a bit of a delay. Okay, just to show the TV there. So while you're busy with them, they can watch the TV while we're scanning whatever movie they have now selected. Okay, I'm going to just run through a few things if I can get my presentation to move on. Here we have the developmental cues, different stages of development. Each stage comes with their own challenges, and I'll show you another slide where where you can maybe look at what you can use to distract the child or to just help you deal with a kid. An age-appropriate approach can benefit your scan and outcome. So I have two little arrows there. I'm using the wrong one. So the color of the arrows indicate the easiness of the kids. The preterm to term, those are easy ones. You can slap them on the bed and you can strap them down. The other arrow, from the 2 years to adolescent, the 12 to 16-year-olds, those are also easy ones. If the child can understand what you want them to do, very easy. That one in the middle, that is a very, very difficult one to deal with. They are busy, and you might not even get through all of the questions that they have, even if they've got questions. But they are busy, basically. So what I want you guys to pay attention is the take advantages and the capabilities, the last two columns there. So for each and every stage of the development of that age, of the child, there's the capabilities of those kids that you can expect, and what you can do as a radiographer or tech. You can use that to your advantage to just gain the cooperation of the child. And then there's a link there at the bottom where I got all of the details for the slide. Okay, immobilizations. In most cases, you will most likely have to make this yourself, and again, it comes in many shapes and forms, many shapes and sizes. Majority of what you get from your manufacturer, it won't suffice for a pediatric patient. We had to basically make straps ourselves. We even lie on the kids, I have to say that, to just keep them down. And all of these things, the immobilizations, the stuff that we use to immobilize the patient is to minimize movement artifacts. And a very small baby, if you can swaddle them in a blanket, tummy is full, dry nappy, comfortable baby, they will sleep throughout. If your child is old enough, again, explain the procedure to them. So you have now strapped your child down onto the bed, your drippy is up and all of that. Make sure that you have a clean nappy on. You don't want to undo all of the things that you have done. So this is now just going backwards. Make sure you've got a clean nappy on, all of that. Get the child on the bed, strap them down, and then you can continue. Restless kids, they need supervision and they need to be reminded that you need to stay still, you need to lie still. At the end of the day, people, it's teamwork. You can't do this on your own because one person will have to set up, one person will have to do this. You might find it easy to ask your nurse or someone to assist. I'm going to brush over this. So have a safe grip, have a firm grip. Lay out all of your equipment beforehand. Everyone needs to step in. Like I said, they are busy, they are fast, and they are strong. Okay. So for dosimetry, we at Red Cross, we use the AANM chart, but there is the North American one that you can also look at. All of our doses, like I just said, it's worked out according to the AANM chart. You guys can have a look at that and follow those for your dosage. Imaging techniques, so this is now where we get to my actual topic. No one likes repeats, like I said, so do everything right the first time. Get your positioning correct. Have a good overlap of all the images. And then sedation. The guidelines on sedating a pediatric patient has changed quite a bit. We don't sedate all of our patients. We don't technically want to sedate them. It's the referring clinician's responsibility to sedate their child, or you get an anesthetist involved to sedate the patient. Anatomical position, it's the best. Make sure that you have all of that right. So your child might not be able to lie in that position for a long time. So when you get to the spot, you can change the hands or the arms so that it is in the anatomical position. Okay, and then just to show you that all joints should be symmetrical in all your pediatric patients. Okay, so this one I just want to show, I included this picture only because for the leg on the left-hand side, okay, so the non-affected leg, that should technically not be in that position. If you want to position your child or to have a good quality image and not to repeat the whole procedure, you want your feet to be the same. Because in the previous one, the one you have, you can see the tibia and fibula a little bit clear, whereas on the other side, the affected leg, you can't see that. So zoom, this is a question we get a lot. You zoom according to the size of the patient, not the age. Smaller babies, you will most likely use a bigger zoom, whereas a bigger child, you will decrease your zoom to about 1. At Red Cross, we only use 1 and 2, a minimum of 1 and a maximum of 2. Avoid contamination, cover your machine, people, please. We had an incident where we had to replace the PSD cover on our detector, which set us back a few days because we couldn't use the machine. The child vomited all over our detector. Play a movie or just talk to your patient. That will just help you a little bit. If you are there, you can just walk them through everything that they are doing and then reward them. Everyone likes something nice after I've done a good job. So reward them with a certificate or a sweetie if the parents allow it. So this I just included here to show, cover up your patient. You don't want baby to spill everything, and that the person sitting there with the child is my colleague. Within the 13 years that I've spent at Red Cross, I have never attempted that. I will much rather let mom hold the child and I will feed. But in your next image, you'll see Fathia, my colleague. She is more capable in doing both, feeding and holding the child while busy doing it. Then I'm on the side, just starting the image. Okay, just a basic outline of what things, how long things will take. Your scans and this information you can give over to the parents and to the ward, because you won't necessarily want a nurse to stay there if they are short of staff. If the child is unstable, unfortunately, they will have to be there. And also for mom and dad who is worried they need to get back to work or something. Hygiene, like I said, I'm going to brush over this. We came out of a pandemic. Everyone, we are adults. Wash your hands, cover yourself, and clean your machine regularly. You do not want to infect patients. In conclusion, pediatric patients need to be treated with the same respect as if it's an adult patient. Don't undermine the child basically because he or she is a child. And never lie or deceive the child. You want them to trust you. At the end of the day, the goal is to gain the cooperation, not just of the parents, but not just of the patient, but of your parents as well. Because at the end of the day, that will give you a good quality or a good outcome at the end of the day. Thank you. And then just some acknowledgements. If you're ever in Cape Town, please come take a look at our newly play park for the kids. Thank you, everyone.
Thank you, Mark.